Yes, good afternoon, ladies and gentlemen. How are you doing?
Good afternoon.
Good. Do I have my gentleman online? Oh. Hey, where's the gentleman? He's not in. Okay,
Yeah,
all right.
yeah.
So, oh, you are there. Good. Usually, since you are just one or two, always I'll ask of you, okay? So make sure you attend all the lectures.
Okay.
Okay, fine. So, ladies, how is the afternoon? Is it raining at your end?
No, please.
No, sir.
I've forgotten. As for C, most of you are from the northern part, or? Are most of you from Tamale and Wa?
Yes, please.
Yes,
Okay.
sir.
Somebody said it's cloudy here. Okay. So Tamale, Wa, and then who again? Do you have any other place joining? Tamale, Wa, and...
Bolga.
Wait, do they have a center in Bolga?
Nope. No.
So you join one center?
Yes, we have Asankragwa.
Okay, so I want the center Tamale, Wa, Asankragwa, and then...
Takrade. Keta.
Hey, so here, it's like everybody is here. Okay.
Asankragwa is also here.
Keta is also here.
Do we have Akimodan here?
No, please.
Okay, so apart from Akimodan, everybody's here.
Yes, please.
Okay, so let's do a quick registry. Let's look at it. Why people, are you there? If you are from Why, respond. Why are you there?
Yes, we are there.
Yes, sir. We are there.
Oh, fine. Tamale.
We are here. Yes,
Okay, Asankogwa, are you there?
Yes, we are here.
Okay, Asanko has responded.
Yes, Asanko is here.
Keta, are you
we
there?
are here.
We are here.
Is Kofi Kenata people? Are you here?
We
So record for no. So it means we don't have Tamal, we don't have Kumase, and neither do we have Akimodan. That's all. Okay. What about Koftan? Kofredia, are you here?
We have Tamale.
You have Tamale. Okay. Kofredia, is Kofredia also here?
No, Koforidua is not here.
Okay, so Kofredia, Kumase, and then Akimodan are not here. All other groups are present. Oh, that's nice. That's nice. Okay, so as for Takrade, I'll be coming there very soon. Okay.
Wow.
I'll be coming to Takrade. I have a short meeting there. So let's see. And now, is the road network better now? Especially from Cape Coast going there.
Yes.
Better as far as Dubai. Even within the town is Dubai.
Hey, Takrade for one no. Okay. It's okay. As for Tadi there, when you're even from Kumasi and you go and live there, their fever will catch you. Well, that's nice. Okay, so let's see. Are you all on the Telegram page? Are you on the Telegram page?
Yes, sir.
No,
Okay. Because the question I asked on the Telegram page, it seems we've already discussed it. So those of you who are not on the Telegram page, please contact your reps. They will link you to the Telegram page. Okay. For this evening, I'll load the PowerPoint and everything there. So let's get in contact with the Telegram page and then let's try to get whatever we put in there. The questions I added to the page. We discussed it last week, those questions. So I'm not expecting you to answer, okay? But let's quickly go to the PowerPoint related to that particular. Those of you not on the Telegram page, please. Your reps are there. Contact your reps. They will put you to the page. Okay? Oboku Mensa Abigail. Contact your rep. Oboku Mensa Abigail. Where are you from? Your name seems familiar. Oboku Mensa Abigail. Oboku Mensa, can you talk? Okay, let's continue. So today I'll share the PowerPoint and then we start going through vis-a-vis your practice, okay? From Viamwasi, I'm gonna, no wonder. Oboku Mensa Abigail. Do you have any brother, an elder brother now in UK? Oboku Mensa. He's also Oboku Mensa. Oh, okay. Fine. Oh, fine. He was my best friend. Oh, fine. I think he went to Prempeh. He went to Prempeh also. Forgot him. Yes. He was a Prempeh boy. Okay. Oboku Mensa Abigail. Okay, fine. Let's try to find out what we did last time. So I will quickly run through the PowerPoint, okay? And I'll be asking you questions. So feel free to answer my questions. And then also, if you can't talk where you are, some of you have learned, some of you are at work, others too are hiding somewhere to have the lecture. Others are in the bedroom, so they can't talk. So you are free to chat, okay? If you can't talk, you chat. I will just do that, okay? Fine. Okay, so let's quickly go to I'm sharing it now. I'm sharing the PowerPoint, so check if you can see everything from your end. Let's see, quickly. Okay, can you see the screen? Is there anything on your screen?
Loading. It's not sharing.
Now sharing.
Now sharing.
Still not sharing? Still?
You can see.
We can see anatomy of the pelvis.
Okay, good. Let me make it big so that we can see it quickly. And I told you that this is some of the revisions that we want us to do. So today we're going to end this PowerPoint and next week start with reproductive system, male and female at the same time. Okay. Just try to take some notions out.
Oh, wow.
So now it's big on the screen. Can you see it now?
Yes, sir.
Okay, good. So, okay, let's go. So as I said last week, we're going to look at the pelvic, the bone, and the muscles, and then we're going to look at it vis-a-vis our daily work. Okay. Now I have 3 statements on the screen talking about hip bones. Oscose, the innominate bones, try to tell you what they fuse, when they fuse, and when they become very useful in aspect. Now, can you read paragraph 2 and paragraph 3 for me? Somebody should do that. Tadi girls.
Sir, please, I'm reading.
Okay, read.
At birth, each of these primary bones are joined together by hyaline cartilage, into brackets, triridicate cartilage, centered in the acetabulum.
Paragraph 3.
Point 3. Fusion begins 15 to 7 years and completes at 20 to 25 years. Thereafter, no traces of fusion line can be detected.
Okay. Now, if you heard what your sister said, and then if you understand it carefully, answer this question for me. Now, let's give you some age so that we can use to work. Somebody who is 15 years, a lady that's 15 years, and a lady that is, let's say, 41 years. So 15, 41, okay? Now, this is their first pregnancy, and they are all at term. So during delivery or during labor, which of these two people do you think will have complication and why? 15 years and 41 years. Yes?
41 years.
Can you raise your
15.
hand first? Please raise your hand. Let's see. No hands up. Let's look at. Okay, I have 15 years. 15 years from Amina to Grace or say. Okay, it keep on coming. 1541, 1541. Okay. Now let's try to get some explanation. Marcella.
Sir, please, I'll go for 15.
You go for 15.
Because, yes, because around 15 to 25 years, by then the bones are not well ossified yet. So if the person undergo vaginal delivery, if not carefully managed, the person can get the joint dislocations and others.
Okay. Okay, another person? Okay, any other person? Okay, I have funny answers there. Rose is saying all at risk. Hi, Rose, choose, I'll say all at risk. Belinda, let me hear you.
Yeah, please, I think it's 15 years because since the fusion starts at 15, it has not fully be completed. So the 15 years will have more complications than the 41 years because the fusion will start at the age of 15 years.
Okay, that's nice. Belinda's version. Any other one? Any other one? Linda Akka. She says 15 because still the bones are not completely fused. That's Linda. Catherine says 15. Abigail is saying 15 because bones are not fused yet, which predispose the person to a lot of complication. Yes, I have Pressure saying 45. Okay, let's get another person. Jennifer, let's hear from you. Jennifer.
41 years because the bones are fused and ossified, so labor will delay. If the person is in labor, if you don't monitor, it will cause prolonged labor and sometimes may even lead to cesarean section. That's why mostly they book them for cesarean section as a knowledge from 35 years. You are not supposed to go through vaginal delivery.
Okay. That's 2 against 1. Any other person so that we have 4 people talking on the issue? Let's see if we can get 2-2. Or we still have 3-1 or 2 against 1 now. Any 4th person? Any 4th person? Okay. Grace. Ajua Bedu, Grace.
Yes, sir. 15 years.
Okay, explain.
Because by 15 years, the bones are not. By 15 years, the bones are not completely ossified. So the woman is exposed to complications and other issues. So due to that, there will be complications that may set in that the woman will not be comfortable during the labor. By the 41, by then the bones are completely ossified. So it might not lead to a lot of complications. Thank you.
Okay. So we have 3 against 1. 3 against 1. Let's get it from a last person so that we get an odd number. Whose hand is up? I have is it Feruza? Feruza.
Sir, please, it's Perusa.
Perusa, okay, good. You have the floor.
Okay, please, with 15 years, their complication is that because of the, oh God, because they cannot, the bones are not fully ossified, the strain is always there. And if care is not taken, the lady can get a complication of foot drop or the joint even not, forming back as it's supposed to. And with the 41, no, as the joints are fully ossified, during labor, there's going to be obstruction. And there's not going to be any space for the joints of the pelvic to dilate or expand to give way for the fetus. So in that case, the fetus is going to run into asphyxia. And if care is not taken, the baby can equally die. Thank you.
Okay. Okay. So virtually it's like 4 against 1. 4 against 1. Now let's look at the practical aspect of it. Now, how many of you have delivered somebody that's 15 years and that was her first pregnancy? How many of you have delivered someone that's 15 years and that was her first? Let's see by hand. Those who have delivered people who are 15 and that was their first pregnancy. Let's see by hand. Let's get the practical experience. Let's see by hand. 15 and that was the first pregnancy. Let's see how many people. Only 14 people. Okay, we have 18 now. I have 821 people online and only 20, let's say 30 people have delivered people 15. Okay, 28 people online now, 31. Okay, 36. Okay, let's pick people randomly and let's see. Ernestina, can you share with us your experience, Ernestina?
Sir, okay, so she was in the house and labor progress. Well, the time she came, she was almost full. But during the time for her to bear down, it was easy. I don't know the process she went through, but like before she came, but when she got to the ward, she was able to bear down easily. It didn't even minutes before baby came out, and baby was big as compared to her height and like the body type. Baby was big than that.
Okay. So that was a perfect delivery, isn't it?
Yes, please. And unfortunate for her, she had a tear.
Okay. So there was no
but it wasn't.
episiotomy. She had a tear.
No, she had a tear, but it was a slight tear. It wasn't that deep. It's just something small.
Okay. So that's okay. Any other experience? Precious, let's hear from you.
Okay, so I also delivered a 14-year-old girl, and the delivery didn't take. She didn't take more hours. The delivery was not stressful; it was easy. Just that it was the pain that she couldn't bear. But when it was time for her to push, she didn't. It wasn't stressful. She delivered easily, and she didn't get any tear. So that was my experience.
Okay. Okay, that's nice. A third person? Let's go 3. A third person, let's say Mausi.
Say,
Let's hear from you.
She came in around 8 p.m. So when it was time for her to push, it wasn't easy. She couldn't because the pelvis was so small that she couldn't push.
So was she able to deliver?
Yes, yeah, but she suffered. I nearly referred her, but unfortunately she was able to. But I have to do her piece before the episiotomy.
So was it any complication? Was the fetus all right? Or the baby all right?
Yes, the fetus. Yeah, no, the baby had because the baby struggled to come out. So when the baby came out, the neck was swollen. Yeah. And the mother too was also having temperature. So I had to refer them to a higher place. But she's okay now. She's fine.
Okay, that's nice. A small tear here and there. Now let's look at those who have delivered people who are 40 and above, and that was their first pregnancy. Let's see by hand. Let's see by hand. You deliver somebody that is 40 and above, and that was the first pregnancy. Let's see by hand. If you've delivered somebody like that, can you see your hands up? Hands up. I have only 4 people. Hands up. Hey, only 4 people. 5 now. You delivered somebody that was 40 and above years. That was the first pregnancy of the person. 8, 7. Yes, 7. Okay, let's see. We have 7 people. Let's try. Benedicta, can you share your experience with us?
Sure. The muscles were rigid. So you can see that dilatation took a long time. It takes long for her to dilate to 10 cm. And when it was time for her to push, she was tired, she was throwing in, she was doing all sorts of things. So I nearly referred her. But luckily, she delivered and sustained a tear.
Okay, so she said, if I heard you right, you said she sustained tear?
A tear, yes, please.
Okay, that's nice. Ruth, Jaben, Ruth, let's get your experience.
Hello, sir.
Yeah, go on.
Please, she was 41 years. She was
Okay.
booked for cesarean section, and then she suggested that she wants to try SVD. So we started induction for her, but it wasn't easy. The labor was prolonged, but later she delivered, just that the pains was too much for her.
Okay, so was there any complication in it?
Yes, please. The baby weighed 3.8.
No,
So she
okay.
had a tear, and it was
Okay, you
sutured
didn't do a
by baby.
biseotomy?
No, please.
Hey, with 3 more thing. Ah.
Okay.
Okay.
If not that, it wasn't difficult
Oh,
delivery.
Okay, that's okay. And let's get another person so that it will be 3-3. Comfort.
So, she was 42 years, but then
Yes.
she was a special needs client. That was her first pregnancy. And we counseled her for CS. We told the relative, they communicated to her for CS, but she refused. So, fortunately for her, she was just in bed. The pains were there, but she wasn't able to show it more like how we expected it. But the labor did not prolong. She delivered within the normal stipulated time, and everything was fine. Baby was fine. Mother was fine.
Okay. So now from the experience that your colleagues have opted out, between the 15 years and then 40 years and above, who do you think will have some complication? Now, those who mentioned the 15 years said everything was all right. It was only one tear somewhere. And then those who mentioned the 41 also said, yeah, the labor was okay, but it was prolonged, was this, on this. If you should ask you that question again, now that you heard from their side, what will be your answer? Who will have some complication? 40 years and above or 15 years? What will be your answer? Type your answer for me. Type your answer. Now that you've heard from them and you've read the theory behind the fusion and everything, what will be your answer? Type your answer quickly. Type your answers. I'm expecting something like a 200 answer. Now, people are saying 40 years and above. Now, you see, 15 has changed to 40 after hearing experience, after hearing the whole truth.
Exactly,
so you see,
exactly.
40, 40, 40, 40, 40 is flowing like water. Ha. Now, the issue, the second question, let it come, let it come. I'm counting. Let it come. It's flowing like water, 40 and above, 40 and above, 40 like that. You don't even see any 15 in. Now, why have you suddenly changed your mind? Initially, I thought you said the bones have not fused, so 15 will have trouble. Anna, why have you changed your mind? Those suddenly. Margaret Adams, why have you changed your mind? Well, I saw you in the beginning, and now you have changed to 40. Why? Maggie, answer me. Some people are saying both. In the exams, there's no both. You have to choose. Okay? Now let's look at the next question to understand what really happens. Let's get the next question. Now, the next question is simple. During labor, what happens to the bones during labor? This one, I want people to tell me. What happens to the bones during labor? Ruth, is your hands up? Ruth, is your hand up? Or is the previous one?
No, sir. Yeah, the previous one, sorry.
Then put it down. Put it down for me. Mercy, can you throw more light? What happens to the bones?
Yes, so during labor, what happens is that all the joint has to, dilate. It has to open so that it will allow the baby to pass through the bony canal, especially with the symphysis pubis. It has to open because at that time the joint is soft due to relaxing hormones, so it has to open so that there will be room for the fetus to come out. Thank you.
I like what you said. You said especially the pubic symphysis. I heard that one. Oh, you didn't say that.
Yes, please. I said
so
that.
Apart from there, which joint would still undergo any change during labor, apart from the pubic symphysis?
I think the causes, how do you call it? Sacrococcygeal joint to the causes has to tilt back small so that the outlet will be somehow, spacious.
2 joints only in the bony pelvic, only 2 joints.
You have the sacroiliac joint too, which also opens small.
Now, let's look at a scientific question now. Now, the pubic symphysis, before labor, what was the angle? And during labor, what will be the angle? Okay, Marcella, your hand is up.
Sir, please, before labor is 90 degrees. Then during labor, 180 degrees.
180 degrees. Okay, that's a perfect answer. That's the correct answer. From 90 to 180. What name can we give to 180? 180 degrees angle. What name can we do it? Okay, Marcella, your hand is still up.
Can I say half a circle?
Oh, come on. I want to accept this one. Bring quite a meaning to. Oh, come on. You people didn't do commas.
Straight line.
Straight line angle. Yes, straight line angle. I don't want any commas. Hey, assembly. So when you look at the pubic symphysis, 90, during labor is going to go 180, approximately 180. Now that movement, which part of the reproductive organ does it affect? When it's opening, what again does it open? Which part? The bones don't just move. The movements are supposed to open certain parts. So the pelvic symphysis, when it opens 180, what part does it affect? Hey, no answer. What part would it affect? Let's see the charts more. You see people are chatting. Okay. Okay, Vivian is saying birth canal. Hey, ask him. The cartilage. Hey, what do you mean cartilage? Pubic bone. So, did you hear the question? I'm saying the pubic symphysis. You say it to dilate. Okay? Up to 180 degrees. I'm saying, yes, that's true. But what part will it affect during those dilation? What part of the reproductive organ will it affect? The bladder. Hey. The bladder, ladies, are you practicing? That should be the first question I should have even asked. How many of you are practicing midwives? Okay, I have Ernestina. Ernestina is saying the vagina. Kate Boache cervix. Boba. Vagina and cervix. Sandra Boatman. Gloria pelvic outlet. Linda Poma outlet. You see, those who go to Google, that's what Google will tell you. Outlet. What's the matching? AI and Google girls. The urinary bladder. Samira. Benedicta. As for Benedicta, she even say ischial spine. Abba. Bene. Why? It affects the ligament. Teresa saying, Teresa was saying, ligament. This class will be very lovely. Bladder and rectum. Alice Sansa. Adobia Yobone. Alice. Vagina and cervix. That's not bad. Okay. So pelvic outlet, when you say it, I know it's from Google. Google girls. Don't bring those answers here. Now, people should talk. Cervical canal. Hey, now, more midwife will feel him. When you are delivering somebody, do you have any part that we call cervical canal? When you are doing delivery. Talk. Scientific. Yes. Pelvic outlet, but it's not from Google say. You see, when you say pelvic outlet, you are still looking at the bone. I'm not interested. I'm saying which part. I obviously vulva. Why no? Vulva. Perineum. Aeka. What the test the prayer? Perineum.
Sir, please the question again.
Sir, the question again, please.
Mommy, people are giving answers, and you want questions at this time. Your people are giving nice answers on the screen, and you want questions. The question was simple. We were talking about the pelvic symphysis, and one colleague of yours said that it increased during labor from 90, it increased to 180, and I was so happy before my mood changed. Then I asked again, that dilation to 180, which part of the reproductive organ does it affect? And these are the answers I'm getting. Mazos. Obviously, Diana, say mazos. Lower part of the uterus. Obi quite was this familiar joint. So those who want question, make a question. Also answer yours. It's okay. Don't type again. Give me your answer. I want oral answer. Yes, Barakisu, let me hear you. Barakisu, let me hear you.
Thank you, sir. So good evening.
Go on,
Please, I have this in mind. I don't know whether I'm right.
Barakisu,
Because
you are not sure, eh? You say it doesn't matter.
I want to clarify myself from you. Yes. So because it will dilate 180 and it's going laterally, it will give way for the fetal head to descend well to fit into the cervix so that it will dilate well. And then the vagina will also open up. So the 90 degrees dilation of the symphysis pubis will help the vagina and then the cervix to be wide enough for the baby to come out. That's what's on my mind. I don't know whether.
Perfect answer. This is the answer I want. Most of your people even said the right answer. I noticed one particular lady. She typed the first answer. When I said, she typed a wrong answer. I talked again, she typed even bone for me. And then she said muscles. Okay. The confidence was not there. And that's my job. I'll push you to make a mistake. So when you still insist, it means you know the right thing. So have confidence. Some of you give an answer. I will shout, hey, maybe it's right too. I'm just testing your pulse. And most of you will change it. Stand on the ground. That's what degree does. Degree is to give you confidence to talk. Degree is not wearing white. That's nothing to do with white. The degree is not the white you wear. It's your brain and the confidence you get. So, my dear, that's a nice answer. Now, let's look at the other joint. Sacroiliac joint. It's from where? And where does it increase to? Pubis symphysis, you saw it, 90 to 180. That's perfect. Sacroiliac. From what angle to what angle? Yes? Hey, I'm waiting. And now I'm offline. Am I offline?
No, sir.
Hey, and the page is quite like that. Hey, this is midwife, so or I'm dealing with midwife, or I'm dealing with somebody else. And these are questions that you do every blessed day. You see, why you are doubting yourself is that you really don't care about the technicalities. You care about delivery. Oh, I will come out. No tear, no one where we. The scientific aspect of it, you really don't bother yourself. So from 90 to 180, what the other? Nipana where we are say 90 to 180. Don't worry, you're going to get there. Sacroiliac joint. Give me the angle before and then during labor, where does it go? Yes? Oh, I want a hand up. No hand up. Let's look at some of your charts. Vivian Eshon, 30 to 45. Hey, Vivian, 30 to 45. Georgian and Chroma, 45 to 90. Patient and Chroma, patient. We say from where to where. So when you give one, we can say, okay. Samira Alhassan, before labor, 30 degrees. During labor, 30 to 38 degrees. Mercy Adams, 90, 60 to 90. I wonder, how can you give different answers like this? And then we have Edith. Edith is saying 45 to 90. We're increasing by 2. Okay, baby. No. Let the answers come. Benedicta, 45 to 90. Before labor, 45. After labor, 90. Abigail Amwa. After Abigail. Abigail, I don't know what to say. Many abrewa how. Or say they did 45 to 90. Comfort, 30. And then 35 to 40. Eunice, 30 to 40. Mavis, 30 to 40. Jennifer, 30 to 60. 40 to 60. Wait, ladies, where are you getting your answers from? What's your reference point? Like, where are you looking at? I wonder why you are giving me this a lot of differences in your answer. Okay, Obi Busa question. Many Brabre will have a question. Sacroiliac joint. What was the angle before labor? And during labor, what will it go? Pubic symphysis, we said from 90 to 180. We understand. So people are doubling the whole thing, 45 to 90. So Beatrice, you said 45 to 60. What is your reference point? Like, when you're free here, I'm interested to know where you had that answer from. Because some people are guessing. Go and find your answers. Go and find your answers. Two to 4 degrees. 15 times 2, 30. 15 to 30. Hey. So you people, please bring your reference material. Whatever you had it from, bring it on the screen and let's see. Because this one, I wonder, I thought as a class, we see maybe 31 to 40. Oh, 32 to 40. But where the difference is? We see 45 to 90. Somebody else saying 30 to 60. Eh? The difference are too much. Why? Abigail, it widens and rotates, but I'm not sure of the angle. Abigail, it's okay. If you're not sure, it seems most of your people too are not sure. They are just giving me numbers. Okay. Now, find the answer. I won't tell you. We know pubic symphysis increases. Sacroiliac joint also increases. So, if pubic symphysis affect the vagina and the cervix, what would sacroiliac joint also affect? Which part would it affect? Pubic symphysis affects vagina and then the cervix. What would sacroiliac joint also affect? Yes, what will it affect? You can raise your hand or you can tap your answers. So you see why I went backwards to look at all these things. Because these are things that you are supposed to know. It has started again. Hey, waist and hips. Anus. Pelvis. Sacroiliac joint affects pelvis. Helen. Adek. Iliac spine. The iliac spine, which one? Which Japan? Is it the anterior superior or posterior superior? Which one? Hey. Pelvic floor, rectum. Aid in twisting the waist. Hey, everybody. Somebody in labor is going to twist the waist. Somebody in labor is going to twist the waist. Before labor, 1 to 2 degrees, and during labor increases to 4 to 5 degrees. Press what Canadian. Alice, it affects the weight. Promontory. It's okay. Don't type again. It's okay. It's okay. It's okay. Oh, it's okay. Hey, boy. Lower back pain, pelvic floor. Hey, more. You are wonderful. Wonderful. And one is a one emoji. Always delivering people. You don't understand the science behind it. The important thing is that you deliver the baby. That's all. I said stop typing. Oh, it's okay. Stop. It's okay. I asked my question. It's okay. Stop. Don't type again. I asked my question. I'm okay. Don't type anything again. It's okay. Hey. And they are still typing. I said don't type again. It's okay. Please. Hey, you did one nicely, perfect from 90 to 180. And I was happy, thinking the others will go smoothly like this.
Sir, please, I have something small to say.
Go on, my dear. Go on.
Sir, your question, I don't know if I'm correct or I'm wrong. I understand that if during labor, the sacroiliac joint, like it's the effect it has for the surrounding muscles, like it makes it soft. So the bladder and the anus is the one that have effect. The ligaments at the anus become soft, so that like if there are feces, that it can pass through for the product of conception comes out, and the bladder too. That's for the anus, and the bladder too. If there's urine inside too, it's like the place becomes soft, so urine flow easily, so that like the space at the birth canal can be adequate for the product of conception to come out.
Mandia, wait. Sacroiliac is affecting anus, and sacroiliac again is affecting bladder. Mommy. I know you know where the bladder is. For this answer, I won't even say anything. I'll leave you to look for the answers. And as a class, debate and give me one or two answers. If your answers are too wild open. Okay, fine. It's okay. I'm saying stop typing, please. Myself, I'm okay now. It's okay. Let's go to the next question. Now, these two joints, or these three joints, we know what they affect. The first one, we know it affects the cervix, it affects the vagina to open, to dilate wildly. The second one, we are trying to find out what it affects. We're going to get the answer. Now, labor pain and menstrual pain. Now, the dilation of these bones and then the contraction of the uterus. Which one elicits labor pain? Is it the dilation of the bones or the contraction of the uterus? Which one do we call labor pain? Dilation of the bones or contraction of the uterus or the muscles of the uterus? Which one do we call labor pain? That's your next question. This one, not typo. The way you type, you people type, I'm even afraid. Let some people talk for me. I think when my ears hears, my eyes will not see. It's okay. So tell me the answer. What do we call labor pain? Type. Hey. Don't everybody. Hey, your friend is you don't understand English or what? Don't type when you are typing.
But I think the pain is because of the movement of the bones.
You say you think it's what?
So please, is the face of the uterus.
The dilation of the pelvic.
Oh,
Hello, sir.
Yeah, come again.
Dilatation of the pelvic symphysis from 90 degrees to 180 degrees.
So labor pain is the dilation of the bones, or is the contraction of the uterus muscle?
Dilatation of the bones.
It's contraction leading to dilatation.
Okay.
It's contraction of the uterus muscle.
We understand. Who again?
Please.
Contraction of the muscles will lead to dilatation of the bone.
Now, to explain that, let me ask you another question. How many of you have delivered? Have given birth before? Let's say you have 847 women and 1 or 2 gentlemen out. So how many of you have delivered before? So at least their experience will help us know exactly what is menstrual pain. And Asina, have you delivered before?
Yes, sir.
How many?
2.
2. Oh, that's nice. And how old is the youngest?
7 months.
7 months.
Yes, please.
And what do you pay no
But show you.
Was it normal delivery or CS?
Please, normal delivery.
Okay, then you have the floor. The latest mother in town. Or do you have some people that are even 1 month old?
So I don't know.
Okay, let's hear from you. Do you think the pain was coming from the bone or from the uterus?
Okay, so the pain starts from the uterus, specifically from the fundus, before it moves gradually. So at the pelvic aspect is okay. So let me come again. It starts from the uterus, from the fundus. So during pregnancy, before descent takes place, the pelvis also prepare itself for the descent to take place. So during labor and the contraction starts from the fundus, that's why it moves gradually. Then the head descent also moves gradually. Then the pelvis with the contraction, as the contraction advances, then the pelvis also widens up.
So which one is painful? The contraction of the uterus muscle or the dilation of the bone?
The contraction of the uterine muscle.
Okay, it's painful than the dilation of the bones.
Yes, please.
Do you know that if the go on?
Yeah, so with the dilation of the bone, it's a short period than the contraction of the uterine muscle. That aspect is when the cervical dilatation has advanced and the product of conception is coming out. But with the uterine muscle, that one takes like a period, but the bone is when like fetus is coming out, like it's ready for it to come out.
So that's what I'm saying. Those 2 stages, which one was it painful?
The uterine contraction is painful than the pelvic
dilation of the bone.
Yes, please.
Because the uterine contraction can go off, so I hope you know. It contracts, then goes, and then come back.
Yes, please.
But the dilation of the bone, does it do that?
No, that one occurs when like product of conception is coming out. So with that one, you wouldn't notice that pain, because with that one you are bearing down, so you didn't notice that pain. Like it's a short period. But the uterine muscles own is the one you feel like for a period. So with that one, you feel the pain more than the bone one.
Okay, that's a nice experience. Very nice experience. Okay, let's get another person. Let's see. Let's get a hand. I saw some hands up. Where are they?
Can I talk?
Who is that?
Marcella.
Marcella, is your hand up?
Yes.
Hey, and I don't see you. Okay,
Sir,
you talk.
Sir, please, is the dilatation of the bones. Sir, because when you're contracting, you feel the hardening of your abdomen. But when you start, you don't feel the pain. You feel the pain around your waist and your hips. So me, I think it's the dilatation.
Not because
because when you are contracting,
That one, you don't feel the pain in your abdomen. It's around your waist. And when the contraction ceases, the waist pain also
Are you
starts.
sure?
Yes.
Hey, Eura, were you giving birth with her? She's talking to us her experience. Let her share her experience,
No,
Eura.
the
It's a
person
free
talking
world.
is so terrible. First pregnancy,
Marcella, continue. Don't mind them. You gave your birth.
When I started contracting, I was fine. I wasn't feeling any pain. It was when I was getting around 4 to 5 years, then I started feeling the pain small. But the pain wasn't in my abdomen, it was just around my waist.
So Marcella, how many kids do you have?
So I have one.
One. Hey.
Yes.
Yeah. One pen now, Kasasa. Hey. I thought you were giving birth like 4 or 5. Okay. Because somebody explained the one who gave birth, who have 2 kids, and you gave 1. So how old is your kid now?
2 years, 4 months.
Hey. Okay, let's hear from Priscilla. Priscilla J.
Okay, sir. I want to answer this question based on dysmenorrhea and during labor. Dysmenorrhea is a pain as compared to that of labor, but there is no contraction of uterus here. Then looking at 15-year and 41 years, who is having more pain? Is the 41-year-old because the bones are completely fused. So to me, it is the bone dilatation that causes a lot of pain during labor. Thank you, sir.
Okay. Priscilla has given her. Priscilla, have you given birth before?
Yes, sir.
How many?
3.
Good. Yes. And all the 3, was it painful or the last one? They're not. Yeah.
No, the first one was SVD, but the 2 were CS.
Oh, okay. So vaginal delivery, how many?
1.
Hey, vaginal here back up. Hey.
Yes, sir.
Okay, that's okay. Yes, let's hear from Owusu Sandra. Koko.
Hello, sir. Good evening.
Yes, good evening, Owusu.
Please, I have only one child.
Only one child. Don't worry. We'll go on it soon. For 100 per.
So please, my own. I fell during pregnancy. When I was pregnant, I fell down. And I stretched my legs when I was falling. So I felt a very sharp pain on my symphysis. So I reported, and the doctors were saying they can't actually know what is wrong. So I should deliver, then find out. When I went into labor, I didn't feel any pain. No pain.
You say you felt what? During labor, you felt what?
No pain.
No pain?
Yes, sir.
Okay.
So when after delivery, it was there that we did some investigation and I did X-ray, and it was indicated that my symphysis really has opened.
Okay.
From the fall during pregnancy.
So during that, thank you for sharing this. Thank you for sharing this. You see, pubic symphysis is fused. If you've never given birth, it has never dilated. But a uterus, either you're giving birth or you don't. Because of your menses, it goes some changes every blessed month. The only thing that is different is the bone dilation. It happens only in labor. Okay? We have some people, some menstrual pain that the person cannot even walk. Some are vomiting and doing all sorts of things. But when the bones comes in, it's then that you understand pain. Okay? So I'm happy that she shared that experience because we have similar case in Kumasi here. Okay? The lady had a car accident and has a pelvic fracture, and so she gave birth without even knowing there's a pain. Because when we have these places that are supposed to be fused already open, during labor, the thing, so there's no pain aspect. Okay? For those of you who have not given birth, if you want to ascertain the pain during labor, this is an example we give. You know your nuggets, there are 10 nuggets. Okay? So if you crash one digit and you feel that is painful, imagine crashing all the 10 at the same time. That is the pain that is tantamount to labor. Okay? Crashing all your 10 digits at the same time, grab the pain you feel in your heart, in your brain. That is the pain that is not even equal to labor pain. Okay? So when we ask you certain questions, usually I want students to share their experience so that we can get the scientific explanation. Labor, remember, the uterus can contract, but when it's not dilation of any bone, you can't give birth. That's why some 40 years and above, most of them goes under CS. Because the bone cannot dilate. It won't mean what? Okay? But pain comes in during the dilation of the bone. That is why people say all sorts of things.
I'm not going to work.
When you baby some labor room out and wild to say yes. Okay. And the commonest one, those who have given birth, or you are all midwife, you can hear what people say. Ni baby too. He no moka say too. Nehi ne too.
Nature.
Eti ho ne too no. Oka say denti ne too. A contraction of uterus na mani too. Debi. Symphysis pubis na by inti na ade ne too. Odim say too akọ. Okay? So get the whole thing. And I'm happy that she brought the 40 years. Somebody else brought the 40 years and those things in. Most of them cannot give birth vaginally. It's not a contraction of the uterus. That's contraction there, baby. But then when they're relaxing, that's supposed to relax their joint. It's minimal. Or when it's even prudent and it even fails to dilate, there's trouble. Okay? So get these answers nicely. When he asks you simple questions like these, don't bring the science out. Okay? I'm happy, and I'm very happy the sister who shared hers. Because we experienced this before. When there's a fracture of the pelvic bone, these people give birth without pain. Okay? So,
yes.
So lady, please, but your second will be more. Can I will be a silly cry? Will be 10.
Sir. So please, I want to find out.
Go on. Who is that? Oh, I can hear some noise, but I can't hear nobody. I can't hear the person. Is the person in the car? Hey, am I money at you?
Sorry. I'm still not convinced with what he said. I'm still not clear. But I wanted to find out so what causes Braxton Hicks, and that's the first aspect. And secondly, can there be a way that there'll be contraction of the uterine muscle for cervical dilatation to be maybe like let me say 10 cm dilated, but the person doesn't feel any pain at the the pelvis.
Do you mean that there's a way to even block pain? There's a natural way and artificial way. That's the next topic. Okay. Now, if you can feel the person's ischial spine, the vagina, what does it mean? If somebody's in labor, you can still feel the ischial spine. What does it mean?
So it means that the ischial spine is protruding into the vagina.
And hence?
So the vagina outlet is not like conducive for vaginal birth.
So it means the person cannot give birth vaginally. The baby's head cannot pass through. Okay?
Contracted pelvis.
Okay, so the issue is that the only way that you can feel that the spine is not a muscle, it's a bone. It has moved out. It's when it dilates. When the bone dilates. It's not a muscle issue, my dear. So when the bone dilates, it's then that the vagina can even open. And the cervix can open widely for the head to come. The uterus will contract because of the hormone and everything to push the baby out. But that can happen. But if the bone does not open up, the spine of the head and everything, you can feel the spine, the ischial spine and everything, the head can never come out. For instance, you said the instant that this can dilate, but there's no pain. It's when the person has a fracture. Number two, we can do pudendal block. I hope you know pudendal nerve. Do you know pudendal nerve, what it does in the body? Hey.
It's the nerve that supplies the vulva.
Pudendal nerve, what does it do in the body? Hey, Ayaka.
There, it serves as a nerve supply to the vulva.
You say it does what? Please come again.
It serves as a nerve supply to the vulva.
Nerve supply to the vulva. Absolutely, it does other things. Vulva ne deɛ well. You see, pudendal nerve is coming from the sacral plexus. I hope you know the sacral plexus. Do you know the sacral plexus? Hey. And then the students been a man, and I'm a call offline. Hey.
Sir, please, we can hear you.
No,
Hey.
sir.
So you are there. Hey.
Why?
No.
Oh, munya botra why? I'm after the sacral plexus. You know, if you go to the vertebrae, let's go to the vertebrae. We have cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacral vertebrae. Between one or two vertebrae, that's where the spine, the nerves are coming out. Okay, so those going to the uterus are coming from the sacral aspect. Okay, and out of them, we have one nerve that we call pudendal nerve. Pudendal nerve has two divisions, internal and external pudendal. One goes straight to the wall and the uterus. Another one goes to the external aspect of it. Now, the good news is that the pudendal passes lateral or just on top of the ischial spine. So you can go with your hand, feel the ischial spine, and then you inject top of it. When you do that, you block the nerve. But we don't inject through the vagina. We inject outside it. So it's like the hand is inside and the injection is coming from the outside. Okay. But inject it that way, it blocks the pudendal nerve. The person can give birth without pain. But the good news is that we don't do bilateral blockage. If you do that, there will be no pain at all. So the person won't even push. Pain during birth is necessary evil. When I say it's necessary evil, it means that it's important to come so that the lady will hurry up, not stuck the baby in there. It's evil also because if the pain is also too much, it can the lady or the person in labor can go off, can collapse. Okay? Or can exhaust all her energy and then the baby has not even reached anywhere. So that's why pain during labor, even in blockage, we don't do bilateral blockage. We block only half so that the pain reduces by 50%. Another way we can reduce labor pain is when you exercise. You see, squatting exercise is an exercise that affects the pelvic floor, the perineal muscles, and everything. To the extent that when you start doing that exercise, you get pain. But if you endure it and you continue, with time, your labor pain and everything, the same nerve that we are talking about has been exhausted. Another way to deal with labor pain is giving epidural. Okay, so we have so many ways to deal with labor pain. If the person has a fracture at the pelvic aspect, and they want to say the region is already open. Okay, so please, these are the ways we deal with labor pain. Which of these methods are you familiar with? Those I've mentioned.
Epidural.
Epidural. Okay, and I hope you know how it's given. All these methods, pudendal blocking, go to YouTube. Go to YouTube. Okay, I had some videos there, but I don't think they are still there. But you can get foreign videos. Epidural blockage. You can see how it's done nicely. If you're a midwife, you learn this technique. This is where you get money. Because when people are going to give birth, they are in pain. If you can block the pain for them and they deliver halfway, the better. Because I want
Sir, question.
Yes, go on.
I witnessed someone who was given epidural anesthesia, and later on, the labor, she couldn't progress, and we had to do cesarean section. Is it because she wasn't feeling the pain?
Yes,
That
there was
was
no
the
pain.
reason why the labor didn't
It's like, my
go.
dear, it's like you going to the washroom and you are not pressed. Okay? When you go to the washroom, you are not pressed. You are just sitting on it. But a camera, wow, bepia, okay? So when there's no pain, I'm saying pain during labor is necessary evil. So that's why I prefer pudendal blockage. For that, you block it halfway. So there's a 50% pain, so she can push nicely. Okay. Yes, my dear. Renan.
Sir.
Doc,
Yes,
please,
go on.
can it fail?
Yes, go on, please.
I said, can it fail the person?
Can you do what?
Can it fail the person?
Can it fail the person? The pain issue?
Yes.
Or epidural
Yes,
will not
please.
fail?
Okay. All right. Thank
Epidural
you.
cannot fail. But when it comes to pudendal blockage, if it's not done by an expert, it can fail you. So if you're a midwife, want to give birth without pain, let us know, okay? You are a colleague, so we do it for free for you. Yes, some hands are up. Lydia Aka, your hand is up.
Sir, the exercise works very well. Because my third month, it was not easy. After a catheter, I said I want to eat. The pain was so very severe that I was even ordering for tears. TSO, 7 TSO. But this time, I found bomb. One doctor told me to do exercise. The exercise, the scratching exercise, so that during labor, you have already experienced the pain. So I was doing it. It was very painful, but I fought. My phone, going to the hospital. It was even very. I wanted very moderate. So
Okay. Lydia, I couldn't hear you nicely, but I heard you say you were doing exercise during your second birth and the pain was very minimal. Yes.
So I
you see,
said the third bone, for the third bone, the pain was very severe. That I only ordered for CS, 7 cm. I was the catheter was shouting for CS, but fourth bone, doctor advised me for the exercise. So I did the exercise and I delivered on the room because the pain was. So now I've been giving the exercise. When you are in 7 months, I'll be counseled for the exercise. I think it's the best.
Okay, thank you. And tell your colleagues, Oba Okotwa Fadia Kra Untimi, Oba Unya 40 years, this is your say. The better way to me at 10 kama. So please tell them to exercise. It's important. Not only during labor, it lets you be a lady. Okay, I've told you one thing that we're going to discuss here is sex position related to your uterus. How they do make it consumness. So these are things that you should know, please. This is for you educating your patient. But remember, for you first, patient second. Okay? Good. So what I'm going to do is that I'm going to load the PowerPoint. The PowerPoint is about the pelvic and the muscles, okay? I'm going to load them there. Go through them. Next week, if you have a question on that, you bring it down. If not, next week, these are revision things that you know. So when you read the PowerPoint, it will refresh your brain. So next week, I will start with male and female reproductive system, okay? So this is all about the bone. I'll load the PowerPoint there this evening so that you take it, read on it. When you have a question, you bring it out, okay? Yes, Georgina. My dear. Georgie.
Hey,
Georgina Nkrumah.
But yes, doctor.
Yes, go on.
Michael, I just want to know the difference between when someone comes to labor, one may have persistent waist pain, severe waist pain, and the other person will be having severe lower abdominal pain. So I want to know
Georgina,
that.
I barely can hear you. Those talking, can you keep quiet so that we can hear her, please? Yeah, Georgina, come again, please.
That's how with regards to the dilatation of the bones. I'm asking that someone will come for labor and then the person will be having severe waist pain. And other ones will come with severe lower abdominal pain. So I want to know which of the pains is related to the dilatation of the bones.
Oh, okay. My dear, the dilation of the bone is not related to any particular pain. If you're not careful, you mistakenly diagnose. Yeah, the issue is that when this bone dilates simultaneously, the sacroiliac, sacrococcygeal, and then they all dilate simultaneously. Okay, but you see, under the influence of relaxing, that dilation is something like a sharp thing. Okay, but you start dilating very slowly and then later rapidly. So when you exhibit pain, like for instance, some people when they are even hungry, they have headache. Hungry, they get headache. Some people too, when they are hungry, they get stomach ache. So it depends on a particular individual. One is pain related, okay? But the good news is that this dilation of the bones will start gradually affecting the waist, affecting even the chest, the abdomen together, okay? But suddenly increase in it. So it starts with the waist actually. Those that will go to the last stage, then it will go to the leg and everything. But to avoid all these things, tell your patient to do squatting exercise. That one does not fail. If even you are not pregnant, if you are planning to get pregnant next year or next 2 years, start doing the squatting exercise. When your muscles are well developed, oh, my dear, pow, okay? Ghana former money squatting exercise. Come on. When you go in the reproductive system, we're going to look at what squatting exercise does to the reproductive organ. Come on. Yes, as midwives, as ambassadors of reproductive system, please start advising women to do squatting exercise. Okay, they should start gradually, 5 a day. Then later you increase 7 a day. That order. Okay? Akosia Boatima. Hey, this class has all my mother's name, Georgina and Boatima here.
Yes. Sir. Good evening, sir.
Yeah, good evening.
Please, I want to know at what gestational age can a pregnant woman start with the squats?
Oh, squat there. If even you are going to give birth, you can do the squatting. You see, the fact that you are pregnant doesn't mean you can't do exercise. So when you are pregnant, it's not a disability. Everything that we do, you can do it.
Yeah.
Okay, pregnancy is not a disability.
Sir, I had an experience. With my first pregnancy. I was very active. So at the ward, I was like doing everything, and it helped me. But I never did the squatting.
You're very active. What do you mean by very active?
Okay, so I worked a lot, and whenever I go to work too, I don't sit down. I do like, oh, I'm pregnant, so I can't do anything. When we are supposed to take patients to theater or to ICU, I was always involved. So I was going up and down like almost during all my shifts. And I remember I never took excuse duty. I was always at post. So I got to 38+1, then delivered smoothly.
Okay.
So I didn't really have any problem.
What about the second pregnancy?
Oh, I'm currently pregnant again, but I'm not having a little pain. It's not like the first one.
How old is the pregnancy now?
Right now I'm 30 weeks.
Okay, 30 weeks.
Yes.
And can you walk briskly as you were last time?
I can still walk, but not as briskly as the first time.
So does it mean you've increased in weight?
Yes, I've increased in weight, but what I've realized is the first one, I was much heavier than this.
Okay. So, my dear, what you can do is to do a gentle exercise. Don't do brisk one. And don't pay your patient. Bye.
Okay.
Meet me up no be one hour. Okay. So don't do
Okay.
brisket. Do calculated risk aspect. Okay, things that you
Okay.
can't lift. Don't waste your time on it. Walk gently and everything. It's important to walk when you are pregnant. Very important. But remember, if you can squat small, don't do it. Okay. And
Okay.
squatting say 2
Okay.
every day. Okay. The idea is that
Okay,
the
sir.
muscle should be stressed. That's all.
Okay, sir. Thank you
Okay,
very
good,
much.
good. So, ladies and gentlemen, as I said, I'm going to load the PowerPoint to your page, okay? Just go through. It's just pelvic and muscles. Just go through. And then if you have a question next week, you ask me. Or you can even ask me the question on the page. When I'm free, I will answer you. So that we can have the lecture off class or off lecture time, and then we continue with our lectures. Okay? Good. So, are we okay?
Yes.
Okay.
Yes, sir.
Tamale, are we okay?
Yes, sir.
Yes. These are my people. Kofi Kenata people. Yeah.
Yes.
Okay.
Yes, sir.
Yes, sir.
Okay. Keta, are we okay?
Yes, sir.
Hey, Keta, is only one person or what?
Yes, sir.
Yes, sir. Yes, sir.
Hey, Keta,
Yes, sir. We are here.
Okay. So it means that, hey, Asanko, share. We refi, share. Asanko.
Doc, please also ask me the Tamale
Yes,
people.
sir. We are here. We are here, pa.
Is it we should ask who?
Just from Tamale.
Oh, Tamale, I started with Dua and Tamale. Oh, I started with one.
We are here, oh, Doc. We are also
don't worry.
here.
Ask again.
Oh, Tamale, how are you doing?
We are fine, Doc. We are fine, oh. We are fine.
Okay, that's okay. So we have Keta, we have Asankuga, we have Tadi, and then we have Wa, and then of course Tamale. Don't worry. Next week, I'm going to load this to the PowerPoint, okay? To the page, Telegram page, and then next week we meet. Please manage to go through, okay? Manage to go through. If you don't understand certain things in it, when I come, you bring it out. I'll give you 30 minutes maximum to go through this PowerPoint so that you can start the male and the female reproductive system. Remember, I said the male, my focus will be on sperm production, okay? Transportation and production of sperms. And then what's the difference between sperm and semen, okay? And then how do we do semen analysis? We're going to go through the parameters one by one. What are the physical parameters, the chemical parameters, and everything that we need to know? What are the rules? We're going to do all that. And then females, my focus will be on the menstrual cycle, uterine cycle, and ovarian cycle, okay? And then we look at the past nicely, talking about the anatomical aspect of it, how to keep them properly, and why is that the vagina does not need your hand in there. We're going to look at all these. Then from there, we start fertilization. This is where we're going to enter into the embryological aspect. Take it gradually one by one. Remember, our focus will be more on IVF. Okay? How do we stimulate? What are the hormones involved? Just as simple. IVF is not difficult. When I take you through, at your end, you can still perform in IVF. Remember, IVF is in vivo, outside the uterus. We have another way that we call in vitro, that's outside. And we have in vivo fertilization, okay? Helping them by hormonal and by medication to get pregnant. That one, you can do it at your end, okay? So, till we meet next time, please make sure you take care of yourself. Come back next time wholly, okay? Those who are pregnant.
Yes, sir.
If you want to go and deliver, let me know, okay? So that I'll know that when it delivers to, this is online, you can join. Don't take it as an excuse, okay? Okay, good. So,
Virgins.
You are virgins. Oh, if you are
God
virgins,
bless
don't worry.
you.
Virgin midwives. Wow, that's nice. Virgin midwives.
Sir, please ask question.
Sir, please, not all of
Yes.
us.
Yes,
Sir,
please ask your question.
I wanted to teach us the treatment for the menstrual pain, but my line went up. I don't know whether it's or not.
Oh, menstrual cycle and everything. We have done. When you do female reproductive, we're going to look at them. Okay.
Menstrual pain.
Menstrual pain. Yes, has done what?
Tell you how we can manage it.
Oh, okay. Don't worry. My time is up.
My line.
My dear, don't worry yourself. My time is up. Okay. For the menstrual thing, we're going to read there very soon. When you do female reproductive, we're going to talk about menses here and there. Okay. Understand what is even menses. This morning, some of your colleagues told me menses, and I was so surprised. How would a midwife believe this is what we call menses? Okay. So I will assume that most of you don't even know what is menses. Okay. So you're going to take it gradually. That place I won't rush. I'll take it slowly. Because when we say Juma, going to do it slowly so that you get the whole concept. Okay. Good. So if you have any particular problem, contact me on the Telegram page. Okay. Then feel free to ask me any question. Okay. So next week we meet again. Okay.
Thank you very much.
Okay.
Bye bye.
Okay. Bye. And I hope, have you finished your lecture for the day?
No.
Hey,
no.
So it's left with
My last one. It's left with one.
With one. Oh, okay. That's nice. Okay, good.
Yes.
So one last lecture left. Let me go and do my lecture and then I'll finish. It will be well, don't worry.
Hey, hello. Madam,